You can. Hi, my
Hi.
name is Sarah.
Nice to meet you, Lauren. So nice of you to come. Have a seat.
Thank you.
So, Sarah, I have here your resume that we've all taken a look at.
Mhm.
Everything looks good so far. So I just want to ask you a couple questions, get it started. So tell me a little bit about yourself.
I'm from Chesterfield County. I went to school at Shenandoah University and I'll graduate in December with my BSN in nursing. I'm outgoing. I don't have a problem really making any friends. My sisters used to always say I can go into a crowd of people and come out with friends that I've met just on the spot. I am a loving person. I'm very passionate about what I do. I enjoy outdoors and that's my stress relief. Mm-hmm.
Wonderful. So you said you're very passionate. So
Mm-hmm.
why did you become a nurse?
Well, my mom, she's a nurse, and I got opportunities to go to work with her as a young child. And my family, we own a barbecue restaurant, so I started there when I was really young, and all this doing servant work and just learning how to serve people. And I think I just developed a heart to serve, and what better way than to help heal patients and become a nurse. And my sister's a nurse, and my grandma's a nurse, so it just worked out. I like nursing.
Absolutely. How wonderful. What certifications do you have, Sarah?
I have my BLS, and I'll have my ACLS in the end of November, and then I'm looking to get my PALS certification. I've had a couple courses with FEMA, the Federal Emergency Management Agency, and a couple courses with American Red Cross. I did a disaster relief seminar with the United Methodist Corporation my freshman year of college, and that will expire soon, but I got some disaster relief work with that.
That's great. Can you tell me, what are your strengths?
I think my strengths are just being level-headed and very consistent. I don't let things get to me easily, and if it does bother me, then I know how to deal with it in a healthy way. I'm organized. I'm on time. I think that I do a good job at communication.
Absolutely. So now, opposite of that, what would you say your greatest weakness is?
Probably organizing patient care. I'm still very new at that, and just learning how to, get everything done in a timely manner. I'm still having a little bit of difficulty with that right now.
Understandable. Now, why would you like to work for us in specific?
I really enjoy the atmosphere at VCU. It's very much a learning atmosphere, and I worked here this past summer in the PACU, and I really enjoyed the environment, the people. They're so willing to just teach you and just show you new things. Even if you've done it before, they're willing to just go step by step to just reassure, patient safety, and everybody's eager to learn, and I think it would be a great opportunity for me to get right in there and learn.
Absolutely, absolutely. So, if we were to do a background check on you, would you have any concerns?
No, ma'am.
Okay. So, what qualities do you admire most in people?
I look for teamwork and positivity. Nobody likes a negative Nancy.
Right.
I really kind of gravitate towards people that are, I guess, for lack of a better word, nice. I don't necessarily like somebody that is going to bring me down, because I want to be treated the same way that, I would treat others. So,
Absolutely, absolutely. Now, why are you the best candidate for this position?
I got some experience in the PACU, so I think, and I really enjoy the OR atmosphere and the whole perioperative atmosphere. I had the opportunity to shadow a bit when I was with Dr. Rawls, my mom's physician that she works with now. I got the opportunity to shadow with him in high school quite a lot, and I just really, really liked going to the OR with him and see how all that works. And being in the PACU this summer, I got to talk to a lot of people, and the OR at VCU is very competitive because of all the residents that come in And so I kind of steered a little bit away from the OR and was really looking into critical care, but I don't think I ever want to abandon that idea of being in perioperative and just the whole surgical side that comes with nursing.
Absolutely. So would you say your grades are a good measure of your ability?
I don't think so. I was an AB student. I definitely excel better at hands-on and do a much better job at Molly, stop it. And do a much better job at at what was I saying? I lost my train of thought.
You're fine. You were talking about how your grades are not a good measure of your ability.
That's right. Yes. So hands-on, obviously, I do a much better job, but
Right.
I think in the classroom, it's so different when you're actually out there experiencing what you're experiencing. When you're in the classroom, it's all books and this and that. But it's very much important to know that stuff. But I was definitely an AB student. Mm-hmm.
Okay. So I'm going to give you a word, and I want you to tell me what that means to you. Okay? So failure.
Failure to me, I think, means I think of mistakes. I think of, the biggest way that I can really, really learn something is by making a mistake. And now, granted, when you're working with something that is much more, I guess, life-threatening, or you're a lot more careful. But when it's something small and you're learning, I definitely learn by my mistakes. Any mistakes that I've made in the past with nursing, I think I've learned a huge lesson from that. But failure, it's a part of life.
Absolutely, I agree. Now, do you prefer to speak directly with someone or send a memo?
Very much directly with someone. I think sometimes the sending memos with somebody there might be a lack of communication or miscommunication, just like texting. You'll be texting somebody and you're trying to get one way across and they might perceive it a different way. So I think face-to-face is definitely, you lose that. Sometimes you have miscommunication, but you lose that barrier that not being face-to-face has.
Absolutely. Now, I'm going to give you another word and I want you to define it. Okay?
Mm-hmm.
Teamwork.
I'm a big supporter of teamwork. When all through college and high school, I participated in sports. I played field hockey. I was the captain of the field hockey team in college and was a huge supporter of teamwork. And I always used to say, like, teamwork makes the dream work, because there was no way that we could win a game with, just 5 people. We needed the full team, the 11 people to win that game. And it's the same way with nursing. You can't have 2 nurses that are good at what they do trying to lead, the whole squad of people. You need everybody putting forth effort to bring out the best patient satisfaction, the best, patient safety rates, etc.
Absolutely. Okay, Sarah, do you have any questions for me?
Let me see. What is the nurse to patient ratio there?
The nurse-to-patient ratio here at VCU is 3 to 2.
Mm-hmm.
So you're going to have 3 patients to every 2 nurses.
Okay. I don't think I have any questions.
Okay, perfect.
Do you have any more questions for me?
I think I might. So, can you tell me why I should hire you? Out of everyone that's applied, what makes you stand out?
I think I can bring a lot to the table. I'm very motivated and I really, really want to excel in what I do. And I think that I've gotten a lot of critical care experience in my preceptorship and had a lot with different devices, different critical thinking pathways. And I think that that's prepared me, and also working in the PACU and seeing the type of patients that are there and how the whole perioperative unit works, and in the pre-op, post-op, etc. I think I can make a great fit there. I'm eager to learn. I want to bring my best to the table, and hopefully you guys can take that and run with it.
Absolutely, Sarah. Absolutely. I think everything everything I've gotten here, and your answers have been great. And I will definitely be looking over everything. I took some notes today, and I'll definitely be in touch, Sarah. So
Okay. Thank you so
so
much.
Absolutely.
Have a wonderful day.
You too.